Dr. Arshad Mahmood here. So in this video, we will discuss about the skin biopsy, that why skin biopsy is performed, what are its types, and we briefly see the procedure of skin biopsy practically performed on a patient. So skin biopsy basically is a procedure in which we take the sample from the skin and we analyze it histopathologically for different diseases. Their indications are very vast. That can be done in case of various dermatological condition as well as various genetic disorder. The skin biopsy sample can be used to diagnose the disease. There are three main types of skin biopsy that are punch biopsy, shave biopsy, and the excisional biopsy. In the excisional biopsy, we just excise the area of our interest for the biopsy. There can be some pathological area in case of some malignancies or skin condition, and we can also take the sample for the genetic disorder and diagnosis for the genetic studies. Second is the shave biopsy, in which we just shave off the area of our interest and we sample the area. And third is the punch biopsy, in which we use a circular type of blade and we punch it and we take the skin and subcutaneous tissue and we sample it for our diagnosis. The sample is immediately saved by using the formalin and then sent to the laboratory. Our interest, our index case, and our practical demonstration is about the punch biopsy. So the needle used for the punch biopsy is basically the instrument used is basically a circular blade. The circular blade is attached to a handle that is typical appearance of a pen-like appearance. So circular blade and the pen-like appearance of handle is seen here. The method of using it, that you just place this uh, instrument on the area of the biopsy and just rotate this handle, the pen-like device. When you rotate it gently, it goes deeper into skin by cutting the skin layers, and you have to go to the whole depth of this blade till the handle. So when you completely go to the depth of blade, you just pull it out, and the sample comes along it, and then we have to save the sample and send it for the histopathology or genetic test as per your case. So now we practically see the steps of this procedure in the next part, and practically this procedure was performed on a patient. Thank you.